I'm really excited to be able to do this because it's been a long time since I gave a talk, as particularly to people involved with oncology, which is one of my favorite patient populations to work with. And like Joan said, whenever I do things like this, I really, I tend to bite off more than I can chew. So this is disclaimer one of the evening. I probably have about an 8-week course, if not longer, in these slides. So I'm going to do the best I can to give you as much information as possible. But if you have any questions, something strikes a chord with you, you want resources to follow up, I have included a resource list. But please feel free to give me a call or email me. And the second piece is, I have done also my best to send you home with skills tonight. I'm a firm believer that people should become independent in managing whatever's going on for them in whatever way is feasible or possible. And part of that is giving skills that you can use and learn fairly quickly, or at least mull over while you're at home. Some of this stuff may seem counterintuitive. Some of this stuff you may be sitting here scratching your head thinking, okay, I don't get it. Or you may think I'm completely full of it. That is a very common response to some of the things I'm going to talk about for people, and confusion is good, but keep a healthy, open mind about it and put it to the test. Anything that I say, don't take my word for it. Try it out for yourself. Go read a little bit more. Go investigate a little bit more. See if it works for you. A lot of the time it does. Otherwise, I wouldn't be standing here after having worked with lots and lots of patients. But it doesn't always, because we're all individuals. So that being said, I'm going to dive straight into this. Obviously, you guys are here, so you know that survivorship and quality of life is a big, big, big issue. Part of this is that I believe survivorship rates have increased so dramatically. Yet it's living with all the consequences of having gone through a battle with cancer that we didn't necessarily realize or have about 20 or 30 years ago when survivorship first got named in the research. And a lot of that comes from, obviously, fear of reoccurrence or metastasis, financial stressors, existential crises. Why am I here? What legacy do I leave? Disruption of routines and changes in functioning, and prolonged side effects of treatment, things like chemo brain and neuropathy and things like that. It's a wonder, to be honest, that I don't encounter more patients who have difficulties with anxiety and depression after going through what so many of you have been through. Because a lot of these are at the root of depression and anxiety for the normal population. You're not alone. So statistics are that 1 in 4 people will go through a depressive episode in their life. That's just everyone. That's not counting chronic pain. Chronic pain, about 70% of people with chronic pain go through a depressive episode, so it's much higher. It's not counting any other health issue. That's not counting any other experience of trauma. That's not counting anything. Just the average is 1 in 4 people in this country will go through a depressive episode at some point. The longer we live with whatever illness it is, whether being a cancer survivor or be with chronic pain or with anything, heart conditions, the more quality of life becomes a central issue. Not just having the time that you fought so hard to have, for many of you, but what do you do with that, right? So, a lot of what I said, what I'm going to talk about is a lot easier said than done, but it's still a part of dealing with all these issues. So the first step that we're going to talk a little bit about is the difference between pain and suffering, because they are different. And it's important to acknowledge that difference, because if you're fighting against pain, you're kind of fighting an uphill battle. I'll get a little bit more into that. That goes into what are the tools that you need if you're not going to be fighting in the traditional sense that we think of fighting. It goes into what are the tools you need to live life in the direction that you choose. So one is tools to deal with the roadblocks and whatever speed bumps or roadblocks come up for you. And the other is finding out what that direction is. So, pain. Pain is a necessary part of human experience. Physical pain is a very necessary thing in our bodies, acute pain, right? You break a wrist, you break your ankle, how are you going to know anything's wrong? What's your first sign that anything is wrong? Pain, right? For something like appendicitis, right? Pain can be sometimes maybe one of the only symptoms that something is wrong. Our body needs pain. It's a part of our lives. Emotional pain, unfortunately, is the same way. It's a part of our lives. Has anyone here ever had somebody die that they loved? Right? We all go through life and are going to have that experience, unless you are a hermit living on some mountain that you've never connected with anybody else. In that case, that might be a really interesting way to live. Not really feasible. It's a part of our life. And it's not good or bad. We're not making judgments about it, but it is a part of our life. A lot of women. How many of the women in the audience are mothers? Okay, I see quite a few. I am too. Quite a few hands, right? How many are mothers more than once over? Okay. The first time, you may not have had an excuse about not knowing how painful it was to go through childbirth. But the second time, you knew and you still did it. Okay. Why? It's because the greater purpose, right, or the ends were more important than what got you there. Anybody ever trained for any sort of physical sport? Okay, like marathon, team sport, anything else, right? Was that a fun experience? I have a friend who runs ultra marathons. He's done the Comrades in South Africa many times over, and we've had a lot of talks about this. He loves to complain about the training process. He loves to complain about how, like, doing these 23-mile runs after he gets home from work and all this other crazy stuff that he does to prepare. And I say to him, why do you do this? Why do you put yourself in this position if you are going to complain about it? He says, because it's nothing like beating that challenge. He wants to run it multiple times to get back-to-back medals and all this other stuff that they do for people who have run it more than once. Sometimes pain can be worth it. Not always, but sometimes it can be worth it. But the pain is a part of our experience. Suffering is not the same as pain. Suffering, I like to have, you can probably tell I'm married to an engineer because I like equations and I like mathematical stuff and putting things in those terms for people, quantifying. Suffering is equal to pain times resistance. Pain is going to happen whether you like it or not. That's just a part of life. Suffering doesn't need to be. It's going to be, because if you look at the equation, anybody who knows math is going to say unless resistance is 0, there's going to be some suffering. And as good as you get at some of these other techniques, I know probably even Buddhist monks who've been meditating for 40 years probably still have an ounce of resistance. So it's probably not going to be 0. But resistance is this idea of fighting against the pain, right? And we're going to talk about acceptance in a minute, because it doesn't mean, in my terms, or the way I think about it, what most people think about it. But resistance is fighting against or refusing the pain in a lot of ways. And that just tends to amplify our suffering. The best example of this is actually a party favor, and I meant to bring some and I left them at home. But how many of you have seen what's called a Chinese finger trap, or Chinese finger cuffs, right? Okay, so for those of you who haven't seen them, it's a tube with holes in the end, and it's normally made of a flexible material. It's a lot of times woven, paper, very simple. You put your fingers in the ends. Guess what happens when you try and pull them out? It tightens, right? You can sit there trying to yank your fingers out of the holes as much as you want. It's not going to happen. That's resistance. What do you have to do, for any of you who have seen the Chinese finger traps, what do you have to do to get out of it? You have to push in, right? And that's what we call, in psychological terms, leaning into, right? Instead of resisting, instead of fighting against, you lean into, and sometimes that reduces suffering. Sometimes when we try to fix things, we're actually resisting. Doesn't mean that trying to fix things is bad, but the question you have to ask yourself is, what are you trying to get out of it? This is an issue a lot of times with depression, anxiety, chronic pain, because for some people, these are things they've dealt with for most of their lives, okay? Depression and anxiety for somebody who is seeking and seeking and seeking and seeking help over and over and over again. A lot of times it's not any one thing that triggered it, but it's been an ongoing struggle. And they've tried many, many, many different things to get rid of it, or they've basically tried a scorched earth policy, anything including the kitchen sink, to just get rid of the anxiety or the depression and feel better. And a lot of times they've put their lives on hold to try and do that. Well, some of the ways that they try to do that may actually make things worse, which is why it's actually resisting. And the putting their lives on hold can make things worse. You can continue to live a good quality of life with anxiety and with depression, with any health condition. It's all in terms of how you look at it. Like I said, a lot of stuff easier said than done. So part of that equation is acceptance. So I like this definition that I found on Wikipedia. They defined acceptance as a person's assent to the reality of a situation, recognizing a process or condition, often a negative or uncomfortable situation, without attempting to change it, protest, or exit. The way I like to put this with people I work with is you don't have to love what you got, like depression or anxiety. You don't have to love it. You don't have to want to kiss it full on the mouth. But you do have to learn to sit and watch a movie with it. Right? I mean, how many of you have gone to a movie theater and sat with some annoying person, their cell phone's going off in the back, or they're talking on the phone, or they're texting, right? But you sat through the movie with them, right? May not have been the best experience, but you did it, and you didn't turn around and punch them, or you didn't walk out, right? So this is what we try and cultivate as an initial step for dealing with some of these things, some of these issues, is that you don't have to want to obliterate your depression. You also don't need to want to kiss it full on the mouth. You need to be able to sit in a room with it. Same thing with anxiety. Because trying to obliterate it is one problem. Loving it is a whole other one. I don't know anybody who's gotten to that point. But you do need to be able to move forward, even though that's going to be a part of your life. The best way to cultivate acceptance is through mindfulness practice. My understanding is that mindfulness has come up before in the Survivorship series and talking about it. And my goal is not to give you guys a whole thorough example of mindfulness or its value. It's something that I've pointed some directions to head in to check it out for yourself, but it is a very valuable thing. Mindfulness is defined a lot of times in this way. Ronald Siegel is a psychologist who's been working with mindfulness in therapy for 30-something years. Very interesting guy from UMass, University of Massachusetts. And his definition of mindfulness, which is a fairly common one, is awareness of present experience with acceptance. Now, the pieces that are important of this are awareness of the present, with non-judgmental, which is the word I left out, acceptance. It's not good or bad, it just is. Or it is what it is, which a lot of people have known me to say, right? Doesn't mean that all of a sudden you love it, doesn't mean it's great, but it is what it is. Thoughts are really powerful, which is why mindfulness is really helpful. We need to be aware of what's going on in our own heads, because our thoughts can throw up roadblocks really, really easily. To give you an idea of how powerful thoughts are, indulge me in a little bit of an experiment. I won't have you guys stand up, but ordinarily if we had a little bit more room I would. But I want you to close your eyes and I want you to picture a chair. Okay? I want you to picture it in all the detail you can muster. So I want you to think about size. Okay? I want you to think about shape. Does it have arms? How big is the back, if it has a back? How tall is it? Maybe it's more of a bar stool rather than a chair. I want you to think about what it's made out of. Is it made out of wood? Is it made out of plastic? Is it made out of metal? I want you to think about how it might feel to sit in it. Now, would you actually sit in the chair you've just pictured? Some people would. And when we've done this, when I've done this at seminars, this is a fairly common example that comes out of ACT, Acceptance and Commitment Therapy. When we've done this example in seminars, we have had people who have actually been standing try to sit in the chairs. What do you think happens to them? They'd fall. Thoughts are really, really powerful. They can create a chair in your mind. You can see it in all this wonderful detail, and yet it's not going to support your weight. The other example I use a lot is thinking of a lemon. If I had you all picture a lemon in all the detail you can muster, thinking about what it looks like, what it feels like, what it smells like, thinking about what it might even sound like as you're cutting into it or peeling it, right? And then I had you picture taking half of it and biting into it. I would wager that probably about 95% of you would have some sort of physiological reaction. Would salivate, would pucker, would have some sort of reaction to it. Our thoughts are very, very powerful. The problem is sometimes we give them too much power. One of my favorite bumper stickers on the face of this planet is don't believe everything you think. Just because it's our internal experience, just because it's going on between our two ears, does not automatically make it true and valid. Thoughts we have in our brains are just like things we have in conversation. Some of it can be fact, but some of it can be opinion, some of it can be conjecture, some of it can be predictions. There are problems that are created when we take everything we think as fact. So being aware of what's going on inside of our own heads and making sure that we don't get hijacked into thinking or behaving based on them just because they're our internal reality is really important. There's two major ways that thoughts can hijack our behaviors and emotions, and this becomes really important for what we'll talk about in a moment, which is using our values as kind of the direction. Remember I said we were going to talk about what's going to hijack things and then what direction you head in. So this is going to be how, recognizing what can hijack or what can be roadblocks or barriers to changing behavior or to having that quality of life, and how do we deal with it? And one of the big things can be our thoughts. One way is something I call twisted thinking. The other term it's known by is cognitive distortions, as it's known traditionally in cognitive behavioral therapy. And in your handouts, I believe, you have a sheet that says 10 forms of twisted thinking and what to do about them. Tool number one that I'm sending you all home with. Recognizing our twisted thinking and being able to take a step back and go, wait a second, that doesn't make sense. Let me respond to that is really important. On the sheet, you have the category. So if you can categorize these thoughts, it makes it a lot easier to deal with them. You have a definition, and then you have what I call the antidote. So there are questions to ask yourself in responding to them. I'll pick out one or two of my favorites, which may or may not sound familiar. We all do these, by the way. We all do them. Anyone who says they've never done one of these is lying. This is absolutely normal. The problem is when too many of our thoughts on a particular topic fall into these categories. It helps to recognize that when you are thinking this way, they're just thoughts. They don't necessarily have weight. They don't necessarily are going have accuracy or are going to come true. It all depends on how you value them and how you react to them. So one of my favorites is catastrophizing. Exaggerating problems and possible harm while underestimating your ability to deal with them. It is one of my favorites because it is one that I do. I'm in the middle of an office move. My office is moving on Saturday. We're moving into a larger office suite. And I went by the office to check out. They're supposed to paint and carpet. I'm very excited about this because it's more space and it's going to be really nice. And I walk over, because it's actually right across the street from my current office. And I walk over and I go in and I peek in the windows and door's locked and everything looks exactly as it did with the old tenant, except for the fact that the old tenant stuff is not there. So they haven't painted, they haven't done any carpeting, and I'm supposed to move in 3 days. I have patients I'm seeing, or not me, I'll be off for Rosh Hashanah, but I have patients that my psych assistant will be seeing on Monday in that office. So I call my husband, I go, you will never believe what they did. I'm never gonna be able to move in. I'm gonna have to call all my patients and reschedule. He goes, are you listening to yourself? I go, yeah, okay. That's me catastrophizing, and it's not that big an issue really. I still have access to my old office. I still can have the furniture delivered and deal with this later. We all do it. The question is, how quickly can you catch yourself and use the antidote, right? The antidote is, how big a problem is this really? If I didn't move in on Saturday, it would not be the end of the world. I still have access to an office to see patients. I have my patients' phone numbers that I can call people and say, there's been a bit of a growing pain or a misunderstanding. We're gonna have to change things up a little. And they would be understanding. Where is it likely to lead, and how can I deal with it, right? So those are the questions for catastrophizing. Another one that I love is shoulding yourself. And this one is using the words should, ought, and must in self-talk. It makes you feel forced to do things controlled and resentful, right? How many times have you thought that you should do something? Again, another one, we all do this, right? When we're working with people about going to the gym, right? I have people who come in, I should go to the gym 5 days a week. Fabulous, bully for you if you can actually pull that one off. But they come back and they say, I totally botched this. I only went to the gym 3 times last week. Wait a second, that sounds pretty good to me. What about you guys? Yeah, right? But they're not giving themselves credit because they didn't meet that really high standard that they set for themselves, right? That's what happens when we do should. I must, I ought, those are all words that really should not be ha ha ha. It's much better, and that's the antidote. It would be much better if they weren't even part of our vocabulary in that way. And that's the antidote. Catching yourself when you're doing things like that and say, I would like, it would be nice, it would be preferable, something else with a more neutral connotation. Because when you don't live up to that should, you're automatically putting yourself on the downside. So that's 2 of the 10, and I would encourage you to read through these and identify which ones of these do you do, right? And start looking at the antidote and how you can apply that. The more you're in tune with your thoughts, the easier it will be to catch them, label them, and respond to them consistently with the antidote. The other type of thought that tends to hijack our behaviors or our emotions tend to be when we think about rules. And actually, shoulding is a good example, right? If we have rules about these things, if we have a rule that if I am late for an appointment, I am going to be met with hostility and rotten produce, right? That's a rule we might want to test. Because who knows? Maybe somebody else is running late and we show up perfectly on time. A rule we don't want to test, right, is don't pick up a downed power wire. That's not one you want to learn by experience. That's one you want to take other people's words for, right? Because if you pick up a downed power wire, you may not be around to determine the results of your experiment. Some rules we have for ourselves for what happens when we do something, or what a situation's going to be like, or how we should behave, should, again, or what a certain situation or what somebody telling us certain information means, some of that should be met with skepticism. And I know another should. I'm really bad tonight. Normally I catch myself more quickly. We need to meet those with skepticism and to try them out for ourselves, right? That's something that is a lot more productive to do. Rather than take it at face value, provided it's a safe experiment to do, right? It's good to test out what we're thinking for rules for ourselves, because it's not always the case. And better to know that than to take something at face value and potentially miss out on things. So we've talked about some hijacking and some roadblocks. Mindfulness, so ways of practicing mindfulness. Formatting got messed up a little bit. So there's formal practice and informal practice when it comes to mindfulness. Formal practice would be sitting meditation, walking meditation. Walking meditation can be a formal practice. Sitting meditation can take a couple of different forms. It can take the form of breath awareness, where you're linked to the present moment through your breath, but it can take other forms as well. There's body scan, which is one that looks at different sensations in the body. There's also a loving kindness formal meditation practice, which I highly encourage for people with depression, mainly because a lot of people who are depressed are extremely self-critical. And one of the first things is to be able to lighten up on yourself a little bit. Nobody likes walking around with somebody behind them on their shoulder criticizing them all day. Just because it's going on inside your head doesn't mean it's any better. For formal practice, a great resource is the website I have up there, www.mindfulness-solution.com. Ronald Siegel wrote a book called The Mindfulness Solution, and it talks about, do I have it on here? The Mindfulness Solution, Everyday Practices for Everyday Problems. And he talks about all these different types of formal meditation practice and how to use them in everyday life. What is really nice, and probably the best thing that I've seen with any meditation instruction book, is that he put up a website with audio versions of all the meditations. So for anybody who's ever tried meditation, I've been doing meditation for since 1998. So what's that? 14 years. So, and the one thing that I've always struggled with is, from the beginning and even now, is that some days I cannot guide myself through a meditation, especially when I was learning. The whole idea of trying to figure this out and do it on my own was very challenging. Having an audio version that walks you through it is really, really helpful. And it's free. So they're all posted under downloads. You can download them to a device or play them streaming. And he has a really nice voice, so that helps. The ones that I like best for people who are starting are his breath awareness meditation, his mountain meditation. The breath awareness is about 30 minutes. The mountain is about 10 minutes. And the body scan is a 50-minute to an hour meditation. They're good, solid beginning practices for people. Another way is MBSR, which is listed, my formatting got a little off, so it's listed under informal practice. MBSR is mindfulness-based stress reduction. John Kabat-Zinn out of either UMass or Harvard, I always forget which one, UMass, thank you, came up with basically this westernized version of Buddhist meditation 30-something years ago. And basically piloted on cardiac patients or other medical populations. It is typically an 8-week class, 2 hours a week for 8 weeks, plus a 1-day retreat where you go for the entire day. And you have to make a commitment to spend a certain amount of time during the week to practice. I like MBSR classes for a couple of reasons. One is it's a commitment and oftentimes a financial one. And if you're anything like me, I pay for the gym, so I actually show up because I don't like paying for something I don't use. So that's one piece. And being part of a group and being able to have access to a teacher and being able to talk to other people about their common experiences is really, really helpful. There are lots of MBSR classes in the area. I did bring flyers for one that is going on. Actually, a colleague of mine is doing in my office, which I brought. But there's many. I know PAMF, Palo Alto Medical Foundation has one. And if you Google them, it will come up. They are accessible in the area. Informal practice is another way of practicing. There's a couple of different options for that. One is taillight meditation. If you get stuck in traffic, start paying attention to all the taillights and brake lights around you. There's so many different shapes and sizes and patterns. It's actually kind of interesting. And it's nice because what else are you going to do if you're stuck in traffic, right? Washing dishes. You can do practically anything mindfully if you're using all 5 of your senses to be in the moment. Another informal practice that's very, very brief, I gave you as a handout, and I call it the 5 senses exercise. Looks something like this, just a short, brief one. Like I said, anything you can do with your 5 senses, you're doing mindfully. This is a really great one, especially for anyone who's anxious. It's a great grounding technique. And even for depression, if you're off on some tizzy about something that happened in the past, so people who are depressed, this is a gross generalization, but I'm going to make it anyway. People who tend to focus in the past are more prone to depression. People who tend to be more focused in the future tend to trend towards anxiety. What's missing? Present moment. Okay. So you start this exercise by taking 3 deep breaths. Not necessary, but helps. And then you start using your senses. You name 5 things to yourself or aloud that you see. 5 things that you hear. 5 things you feel tactilely. So might feel, for me, my sweater on my leg, right? Or the cuffs of my sleeves or my hair. And then 5 things you smell or taste. Those are combined. Those are the hardest. There's a very particular order to this because what you want to do is see is very easy, right? In my office when I do this, I'm a book junkie. I've got books and magazine and journals and stuff all over the place, never mind that I like to collect artwork and whatnot. Somebody sitting in my office, I joke, could easily name 200 things if they got down to the titles on the books and being really, really specific about stuff. What you hear, that requires a little bit more focus on the present moment. And it's more of an external focus, right, on what's going on around you. 5 things you feel requires as much or more focus than what you hear, but that's more of an internal experience, right, rather than external. And smell or taste requires the most concentration because unless you've just had a meal, or I've just had lunch in my office and that's where we are, you're really not going to be able to detect that stuff unless you have an amazing nose. Very quick. When I do this with people, it takes probably less time than it took me to explain it. And you can do it anywhere, right? You can be standing in line at the post office. You could be in the middle of a really boring meeting. You can be at a doctor's appointment. That, along with diaphragmatic breathing, which is another thing that I recommend to a lot of patients, you can do anywhere, anytime, and nobody's going to know. Those are the best kinds of tools. So we went through kind of ways to learn. MBSR class or a sitting meditation group. There are many of them in the area, and I know probably if you Google either one, it'll come up, or there may even be resources here. I don't remember. To read one of the many books on the topic, I have a couple of books listed in the resource page that I gave. I have other suggestions for people if you don't like them or you can't find them, which I would really be shocked. And the other option is individual therapy with a therapist. So whether it's an MFT, a marriage and family therapist, a psychologist, or a social worker who does use mindfulness in therapy, because then you will get to use it or learn it. So, talked about paying attention to our thoughts and dealing with those wonderful, wonderful roadblocks and hijacking. So now that we know how to deal with the hijacking problems, what direction do you head in? So, it's a good question. A direction might be what your values are. Now, values are sometimes hard to define. That's good. They should be. Values are not goals. Goals are anything you can basically check off and say, I did. Going to the gym 5 times a week. Although I'm still waiting for somebody to actually pull that one off. That can be a checkbox, right? Attending events in your family's lives. If you have children, showing up at plays, showing up at activities, sitting down and doing their homework with them. Those are goals. That's all checkboxes. A value might be being healthy, right? And you can get into all sorts of detail. A value might be changing my diet, eating healthier. That's not a checkbox. It could be if you had specifics, but it doesn't have to be, right? It might be being a more loving parent or being a more involved parent. The nice thing about values as opposed to goals is they're things that are important to us that you're never really finished with. You're always moving towards it. So there's no end. And you can move towards it as much or as little as you are capable of in that moment. Somebody who is really struggling with depression and has the value of their career is important to them because of whatever reason, they can work towards going back to work in tiny steps or big steps. Somebody who is trying to change their health with exercise and diet can make one small change of I'm eating 1 vegetarian meal a week, or they can make a giant one and decide to go vegan. Either way, they're still moving towards that value of being healthier through healthy eating. It's not a race. The whole idea is to move in a direction in our lives consistent with our values, with whatever we've got in terms of how little or how much we can give to them. So the question is how to figure out what we value. So probably the first thing in your packet, or the handouts, was something that is labeled Values Compass Exercise. This is something that is worth doing, whether you're struggling with something in your life or not. And there are instructions, but I want to take some time to walk through and talk a little bit about it. So there are different domains. There's 10 different domains listed on this sheet. There's work and career. There's intimate relationships. There's parenting. There's education and learning. Friends and social life. Health and physical care. Family of origin, which we typically mean family relationships other than marriage or parenting. So siblings, parents, that kind of thing, cousins. Spirituality, community, life, environment, and nature, and recreation and leisure. This is not necessarily an exhaustive list. If you come up with another domain, feel free to make another square. This is just how I have chosen and how some other people in the field who use this kind of technique have chosen to define things. Doesn't mean we've got the market cornered on this. What you want to do is you want to start off by rating how important each of those domains are to you. Not all of them are going to be important. Not all of them are going to be super important. You need to decide for yourself how they rate. You can rate them on a scale of 1 to 10. You don't have to use the 0, 1, 2 scale that I have. But figuring out how important they are to you is important because that's going to help you decide where to focus later. The next step is to rate your satisfaction with that area. How satisfied are you? If it's not very important, you may be totally satisfied with that. You know, who wants to put energy in something that they don't think is important? But if something's really important, but you're feeling like something's missing, you might rate it as not very satisfied. And that might be something to take a closer look at later on. Because maybe you want to shift things. Maybe you want to change what you're doing. The next step is to write down an intention for anything you value, any of the values you've rated as a 1 or a 2. So moderately important or very important. This should be a statement that captures what's most important to you in that area. So not a goal, not an endpoint, not something you can check off, but just what's important to you in that area. So one example is, I'll take from health and physical self-care, right? Because that's probably very appropriate. How and why do I want to take care of myself? Or how and why do I take care of myself? The want may be a word to put in there because a lot of times people are not currently taking care of themselves the way they want to be taking care of themselves, right? Why do I want to take care of my body and my health? That's going to help with what's important there. How you answer that may determine whether you spend time at the gym with strength training, whether you spend time focusing on your nutrition, whether you spend time just being outdoors more and not sitting in an office chair. If you figure that out, I'm very envious because I sit way too much during the day. The next step is you want to put down a number next to A, which stands for actions. This is how many activities have you engaged in that domain in the last 2 weeks. Could be longer, but that's a good time frame typically. So 0 is no action, 1 or 2 actions, 2 is 3 or 4, and 3 is more, right? You really want to look for, one of the things that's important when you're doing this is you want to look for something. If you have something rated as a 2 for importance, you've rated really, really, really important to you, and you've got a 0 or 1 for action, there's a problem there, right? Because your actions are not living up to the importance. You're not putting your money where your mouth is. And so that's something to reconsider. How can you change that? Now, one answer might be that it's simply not that important, or maybe you need to examine that importance level. But the more likely answer is that you need to be reconfiguring how you're spending your time to support what you feel is important. The other question to ask yourself is, what are the barriers to increasing those actions, right? If you want to do more with family or you want to do more with your physical health, what are the barriers that are keeping you from doing that? The more you brainstorm what the barriers are, the more you can do something about it in terms of alleviating them, reducing them, anticipating them before they come up. Does that make sense? Like I said, I like concrete, structured ways of doing things. It's one of the reasons why I gravitate to cognitive behavioral therapy. Probably one of the reasons why I married my husband. He's an engineer. So this is a good way of spelling out exactly where the issues are and giving you food for thought about how you might change things. And this becomes your compass. When you think about how to incorporate these things on a daily life, how to increase your actions in these areas, that gives you a direction to head in. Doesn't mean you have to double the number of actions. Maybe 1 week it's increasing them by 1. Maybe 1 week it's just holding them steady at a level that you find acceptable. And maybe 1 week it's doubling them. No matter what the actual numbers are, you're still moving in that direction. Right? We talk a lot about self-care. Therapists are famous for it. You've probably heard it a lot yourself. And I've always been really frustrated, really, really frustrated. We talk a good game about self-care, but what the heck does that mean? It's this nebulous concept. We're supposed to be taking care of ourselves. But really, how do you operationalize that, right? How do you break that down for people? So one acronym that I found for self-care comes out of DBT, DBT is dialectical behavior therapy. DBT clinicians love acronyms. There are so many. I would never be certified as a therapist in DBT just simply because I would not be able to remember all the acronyms. However, I really like this one because I feel that it breaks down a recipe for self-care in a way that's easy for people to understand and use. So, MEDS stands for, and I'll go through each one, mastery, exercise, diet, drugs, socialization, and spirituality. Mastery is this idea that we do something that we feel competent or skilled at, or we feel good about ourselves on a regular basis. This is a very important one that's often missing for people. It's important because if you don't feel that you are worthwhile, or you don't value yourself, you don't feel that you are good at something or you're contributing or that you're worthwhile, why on earth are you going to take care of yourself? So this can be something career-wise. It can be something as simple with a lot of the people that I work with who are very, very depressed. It can be something as simple as checking 3 things off of their to-do list that have been sitting there for a month. Right? Sense of accomplishment, sense of skill, they've done it. But it's a necessary piece. Exercise. Exercise is an important piece of self-care. Exercise does not necessarily mean going to the gym. Exercise can be as simple as parking at the opposite end of the parking lot and walking the rest of the way into a building. Exercise can be as simple as parking at the opposite end of the mall from where you need to go and walking the length of the mall, or taking the stairs instead of an elevator. That's unplanned exercise. Things like going to the gym, going to work out, training for a run or a bike ride, that's planned exercise. There was a study done, I don't know the citation off the top of my head, but if anybody's curious, you can email me and I'll be able to send you a copy, that looked at planned exercise versus unplanned exercise. Any idea which group had the better health benefits? Unplanned. All of you are excellent. Yes. Initially, the people who are going to the gym on a regular basis had the better health benefits. But about 3 months or 6 months, I can't remember which one, there was actually a crossover effect. And the unplanned exercise group did much better with the health benefits rather than the planned exercise. Both are good, both are helpful, both have their own pros and cons. But one thing we did learn from the study is that unplanned exercise is small changes that you can make in your everyday life that can have big benefits in the long run. So when I talk about exercise, and when you hear people talk about exercise, don't think in simply go to the gym, work out, weight train, go for a walk, go for a bike ride. Think in more flexible terms. Diet. Eating a healthy diet. Our body runs on what we put into us. It's as simple as that. The better you eat, the better output you have. This doesn't mean you necessarily need to go hog wild. Making small improvements again in your diet, eating more fresh vegetables. Eating a vegetable at every meal if you're not doing that can sometimes be good enough. Other people want to make drastic change, and if that's what you want, more power to you, go ahead and do it. But what I will tell you is small successes breed success. So the more you can have success with making a change, so sometimes small is good, the more likely you will be to keep it up, and the more likely you will be able to make other changes. So just keep that in mind when you're thinking about making changes. Drugs. I'm talking about, well, both the illicit and the legal. So drugs is not doing things that you shouldn't be doing. So watching how much alcohol you consume, not doing illegal or illicit substances. But it also means taking prescription drugs as prescribed. So it means taking, if you're a diabetic, taking your metformin or your insulin on a regular basis. It means that if you are being prescribed antidepressants or anxiety meds, and you've had a discussion with your doctor and your psychiatrist about the merits of it and all the values of it and why you're taking it, it means take it. Don't monkey around with it. I know patients who decide, I'm just going to take it every other day. Guess what? Doesn't work. If you have concerns or don't want to take it, talk to your doctor. By all means, there are other options. But if you're being prescribed something, take it as it's being prescribed. That also includes if you're taking supplements, let your doctors know. I don't remember how long it was ago, but there were a lot of drug interactions being seen in the elderly. And what ended up causing it was grapefruit juice. But it took a while to track that down because nobody was talking about the fact that they were drinking grapefruit juice because it was touted to be so great for their health. If you're taking supplements, I know not all doctors are supportive of homeopathic remedies. I know not all doctors are supportive of supplements and holistic meds, but tell them so that if something happens, if there is a drug interaction or an adverse reaction, they do know. And that goes into the category of drugs. Socialization. A lot of times people with anxiety or depression or with health problems get isolated. You don't have to be a social butterfly. There are plenty of people who are introverted. I myself am an introvert. I recharge my batteries by being at home with a good book, or my dog, he doesn't count. And that's fine, but you do need to be around people. So socialization doesn't mean going out for coffee with your friend every day necessarily. It does mean connecting with people on the phone. It does mean being out in public, going for a walk outside where there are other people, doing something to connect to the community or other people in general. Doesn't mean you have to be a social butterfly, and if you're an introvert versus an extrovert, that's going to look very different in terms of how you fit that need.
Where does social networking fit in with that, in your opinion? Loaded question.
It is a loaded question.
I'm not a fan.
So I kind of, I think there are things about it that are more effective, and I think there are things about it that are less effective. I think it's an interesting trend that with Facebook, I can reconnect with people that I haven't spoken to since freshman year in high school and see how they're doing. Great, wonderful, kind of, a voyeuristic sort of thing. The not so effective thing is that far too many of us are plugged in over the web and not doing enough in-person interacting. And there's been a number of studies that have talked about social relationships for kids and teenagers growing up with online communities and not socializing in the real world, for lack of a better term. So in this case, it doesn't count. It doesn't count. If it did, I know a lot of people who are agoraphobic who would be nailing that one every week, but that's not really the general idea. It can be helpful in helping somebody to branch out or get connected, but it's not a substitute. That answer? Last one, spirituality. Spirituality does not, in my book, mean organized religion. Even atheists can have some sort of spirituality. And I use that because I live with an atheist who I think has some spirituality. And he may watch this video later and think I'm completely nuts, but we'll find out. Spirituality is just an idea of this connection to something larger than ourselves. It can be that we think there is a higher power. It can be a religious community. It can also be a connection with nature, going out and hiking, or a connection with other people or other philosophies, or furthering the idea. My husband's a big fan of logic and reasoning and would like to teach it maybe someday. It's this idea of furthering that cause and being part of that larger community and that larger piece of the world. So spirituality has a very broad definition in the way I see it. And incorporating something about spirituality on a regular basis. For some people, it's meditation. For some people, that's prayer. For some people, it's as simple as thinking about a problem, or thinking about something in society on a regular basis. Values are an easy thing, relatively, to incorporate into meds. And a lot of times they come in, well, some of the physical health issues can come in exercise or diet in terms of values, or spirituality, but mastery is a good one for where you can incorporate values. Because if you're doing something to move towards your values, chances are you're getting a sense of satisfaction or a sense of competence or a sense of skill from doing it, and doing it successfully that would meet the idea of mastery. The last thing I want to bring up is this idea of using meaning to reduce suffering. And this goes hand in hand with values, but it's something completely different. I was so fascinated with this topic that I did my dissertation on it. Meaning can take a couple of different forms. We talk about things like post-traumatic growth, stress-related growth, or benefit finding. It was first discussed in Viktor Frankl's Man's Search for Meaning. Viktor Frankl was a psychiatrist during World War II who gave up his visa to come to the United States and teach in order to stay. His wife and his family perished in the camps. He talks about, and Man's Search for Meaning is his theory about meaning making in the second half, and the first half is his story. He was able to attribute meaning to his suffering during the war because A, he lived to promote his theory, but more importantly, B, when he was at Auschwitz and one other camp, he ended up being the camp doctor. And there were many, many, many other people, other inmates, other people in the camps who survived the war because he was there, because he was able to offer medical assistance. This idea of meaning making, or whatever you want to call it, because it's got a bunch of different names, is well documented in cancer survivors. There's a lot of research out there that show that it happens. I'm fascinated by this because I think it's awesome for the people for whom it happens. How do we help people who can't or haven't had that experience to do it for themselves? Because when you do meaning, when you attribute meaning, when you learn something from it, it helps you to move forward in your values, and it helps to set a different tone and set your thoughts in a different way for the experience. So the last thing in the packet that we haven't gotten to, but I urge you to take a look at home, is a copy of the stress-related growth scale. This is a scale that's used to measure stress-related growth or benefit finding for people. And I like going over it with people or having people go over it, because it offers up some things that you may have learned from your experience that you might not have thought of. And it's always interesting to me what people learn from their experiences. So take a look and see what comes up for you and how you would score things, because maybe there's something you learned from this journey that you didn't realize you did.